Hi, I'm Janet Bowman, and welcome to the pediatric portion of your Advanced Clinical Nutrition course. I've been a dietitian for almost 30 years, and I currently work as the NICU dietitian and pediatric specialist at Providence, Alaska Medical Center. I've also had the opportunity to work at Phoenix Children's Hospital in the PICU and at Primary Children's Hospital on the immunocompromised floor, which included cancer and transplants. So let's get started. This portion of the course focuses on the nutritional assessment and medical nutrition therapy for pediatric patients from term infants to 18 years old. It will cover some basic medical and PICU nutritional practice, but it will not cover the NICU. Many dietitians are nervous when the topic of pediatric nutrition is brought up, and that's understandable. Pediatric nutrition is one of the more difficult specialties to master, as every age, stage, and gender has different nutritional requirements. Just as an example, if you look at a 2-year-old female versus a 14-year-old male, their estimated needs and assessments are going to be much different. Along with this, diagnosis and disease processes look somewhat different in children than in adults at times. For example, congenital heart disease in a young baby looks much different than, say, atherosclerosis in adults. And you always have to factor in achieving adequate growth in both acute and chronic diseases or injury. So, where do you even start? The nutritional care process doesn't look that much different than what you would do for adults. For any age, you must develop a nutritional picture of your patient by gathering all the appropriate information and then formulate a nutritional care plan. Because of the scope of pediatrics, much of the MNT focus of this unit will be on inpatient therapy, but the nutritional components translate perfectly to outpatient therapy as well. And finally, please don't hesitate to ask questions. During these 3 weeks, we'll only be able to really skim the surface of pediatric nutrition. If you do have a question, I'll do my best to get you the right answer. During week 1, we are going to cover tools to perform a basic pediatric assessment with an overview of nutrition assessment components, which include patient history, food and nutrition history, laboratory data, medications, anthropometrics, and estimated needs for non-PICU patients. During week 2, we're going to dive in a little deeper into nutrition assessment, including the NFPE, or the Nutrition Focused Physical Exam. We're going to examine Z-scores more in depth. Also, we're going to look at diagnosing pediatric malnutrition and what the criteria is to meet this. We're also going to discuss needs for catch-up growth and basic micronutrient supplementation. And we'll also take a look at some other common growth charts you may see and some estimated need modifications for specific diseases. And finally, we'll look at some pediatric nutritional challenges that are common in Alaska. Week 3, we're going to move into the PICU and cover formulas, enteral nutrition basics, parenteral nutrition basics, estimating needs for critical care, common PICU medications and nutritional effects, and finally, anthropometrics and our expected growth in the PICU. So if you're ready, go ahead and move on to the first module for week 1 of this 3-week pediatric nutrition portion of your course.